Good evening, everybody. Welcome back to the living room. It's so good, as usual, to see so many familiar faces, and it's even better to see so many new ones. For those of you that this is your first night here, thank you so much for coming. Welcome. It's, I think, a perfect introduction into the living room with tonight's topic about sort of coming to terms with your diagnosis and the impact it has on sort of everyone's emotional well-being in their daily lives and in the process. We've got Dianne Shumay here tonight from UCSF. She's a clinical psychologist up there, and we're really happy to have her come in and talk tonight. We're going to start, as usual, with an around the room. For those of you who are new, you see all the cameras, and we've got Andrea over here at the high top monitoring the live stream. So welcome to everybody who's signing in online. We're really happy to have you. Be sure to give a shout out and get Andrea your questions and have her wave at me in the corner if she needs something. But we're going to start with introductions. You do not have to introduce yourself if you don't want to. That's completely up to you. This is for the new people. I recommend you do. It kind of helps if you explain a little bit about who you are and why you're here and what your situation is, so that the rest of the group can help with some feedback. So I'm going to start with Sally. What I am going to ask you to do, as always, is sort of for those of you who know, just kind of keep it short and sweet. We've got a full house tonight, and we really don't want to miss out on any time with Dianne. So, Sally, do you want to start?
Well, first of all, I just want to tell you, I saw Elaine today, and she said, Elaine Gray, who used to come to these meetings with me, and she said to please say hello to everyone. She had it marked on the calendar that tonight was the meeting. I walked in, and she said, "Are you going to the meeting tonight?" So anyway, I'm Sally. I was diagnosed in 2009. I was found very early, and I had my lower right lobe removed, and I had stage 1A adenocarcinoma and large cell, non-small cell. I don't know what I'm talking about. Anyway, I'm doing great. Thank you.
Hi, I'm Martin. I'm here tonight with my wife and Valentine, Carol, who was diagnosed in August. And to make things even better, I went to high school with Sally.
That's cute.
Yes.
My name is Rosemary, and I was diagnosed a year and a half ago with adenocarcinoma and had a lobectomy and went through chemo, which didn't work. Then I had molecular testing, and I was diagnosed with positive mutation with HER2, and I went on a targeted drug. And I'm not sure what my situation is now. I had a lung infection in December, and I'm looking at undergoing genetic testing and perhaps using mouse models to test my tumor and possible remedies, with targeted drugs.
Yes, I'm Athena, and I've been on Tarceva for 2 years, and I have stage 4 non-small cell lung cancer and stage 1 breast cancer, and I'm doing great. And I just got back from Maui with my husband, and we went whale watching and having a great life on Tarceva.
Hi, I'm Molly Golbin, and I was diagnosed in November of 2013. I'm EGFR positive on Tarceva, and many of you may have seen the documentary that came out last year. It was also re-aired in January about my story. I did radiation on the main tumor in November, and so far so good. So feeling okay.
And just as an FYI before we move, Neil, sorry. So Madison and Dylan are here with Molly tonight. I don't know where Arash is. Molly's husband. Oh, he's over there. But Madison, just as so all of you know, is taking Girl Scout cookie orders tonight. So after the meeting, if anyone would like to order some Samoas or some Thin Mints or something else really amazing, Madison's the lady to see.
She has her eye on the biggest prize for Girl Scout cookie sales, so we're committed to helping her.
First, let me say that Molly is being very modest. The film that she made, which was re-aired just a couple of weeks ago, is really sensational, and for anybody who has not seen it, it is worth looking up. It is quite something to see her talk with her doctor from Stanford and a lot of the things that she's going through as a young patient and a young mother. So I urge everybody, please take a look at it. She also does a great job on TV.
It's on our site.
And I think maybe she has a role in NBC or some new series coming up anyway. But she also is a motivating force for me. And I do want to say thank you to all the people who helped me a couple of weeks ago when I went to speak with Eli Lilly in the cold Indianapolis wintertime. They invited me back sometime. I said, okay, anytime in the future when it's above 65 or 70 degrees, I'll consider it. But single digits are not my forte and not anything I'm looking forward to. So I'm Neil. I was diagnosed 3.5 years ago. So it's adenocarcinoma, stage 3, 4, 5, whatever number you'd like. I just had brain radiation about an hour and a half ago. And the good part about that is, and I have 9 more to go for that, they did confirm there is something in there. So if you have to have it and you can get confirmation of that, at least there's something good to go for. I would suggest also that any of you who may have been told by their doctor that perhaps it's in the future, that you look at the trials that are just being done now and some of the new research that's being done to try to spare your memory in the future, and insist with your doctor, as Bonnie insisted to me, and my wife also insisted to me, and I didn't really need too much more insistence, to make sure that I conveyed the message to my neuro doctor that this was the way I was going to have it done. Whether it helps or not, it's a good question, but at least they're going to spare the hippocampus, which is an area that is thought to be one of short-term and maybe long-term memory. So although it may not be the standard of care, don't let it stand in your way. Any treatment, if you find one that you're interested in, pursue it, is always my suggestion to you. Make sure your wishes are known as a patient and be as active as you possibly can. And if for some reason you can't, find somebody at the foundation or somebody else who can speak for you, because otherwise your wishes will not be heard and the way you want things to be done may not happen. But you want it a certain way, tell them. It's your body, it's your head, it's your lung. You make the decision.
I'm Eric. I'm with Celgene. We partner with this foundation. It's an amazing foundation. I just feel fortunate to be here. I try and make these whenever they come about. I've been pretty good like the last 3 I've showed up, but it's an amazing foundation. We love working with you guys. I just feel fortunate to be here. I love all your stories, and it's motivating for me. Thanks.
Hello. Hello, everybody. My name is Yvette, and this is our first time here today. And tomorrow will be 1 month that my mom got diagnosed with stage 4 lung cancer, endocarcinoma. And she is going to begin her treatment actually this Thursday for targeted therapy. And I think it's, we're not sure on the names yet. Again, this is very recent. And we're very happy to be here and to have found this support group. And I mean, I already feel inspired and very supported by all of your stories already, and encouraged. And I feel very blessed to be here with all of you. And so we hope that as the the months go by, that all of you can be part of our journey, and we can be part of your journey, and get to know all of you closer. And thank you for having us, and Bonnie for talking to us and taking the time to speak to us. We already feel very encouraged, and I think we're still in shock. I think it's been still very recent, so we're still starting to figure out our new, if that makes sense, our new way of life. But once again, thanks for having us.
Yvette, I just want to welcome you and your mom and tell you you should be encouraged and you should be hopeful. And this is a fabulous group, and you have every reason to hope for a really bright future. My name is Joyce. I was diagnosed in 2011, originally stage 3B adenocarcinoma, non-small cell lung cancer, inoperable. Since that time, diagnosis has changed. I don't know whether the cancer morphed or it was a misdiagnosis. It's now considered a neuroendocrine, a large cell lung cancer, neuroendocrine. Never had surgery. I'm on my third line of chemo right now. In between second and third, I had tissue sent to Foundation Medicine out of Boston and did genomic profiling, and was for a while doing a drug called everolimus or Afinitor, which was really interesting because it's not generally considered a drug ever used. It's never been used for lung cancer. It was used mainly as an anti-rejection drug for people who had kidney transplant. But it worked really well for me for a year until it didn't. And I had a little rough patch back in the fall. So I spent the last few months back in radiation and concurrent chemo, just like I was 3 years ago. And this time was harder for me, and I think it was the chemo agent, topotecan, was brutal. But I did get my oncologist to switch me to a different agent, and so now I'm taking an oral med. It's actually the etoposide, which was 50% of my original chemo cocktail back when I was first diagnosed. Anyway, I'm tolerating it. I feel great again, and I'm just happy to be here, and we'll pass this right along to Mary.
Hi, I'm Mary, and I was diagnosed in October of 2010 with stage 4 non-small cell lung cancer, and I did 13 rounds of chemo, and then radiation, and then I was off all medicine for 10 months, and then I started Tarceva because I have the EGFR, and did really well on it for 2 years, and now it's not working for me anymore, so I'm on afatinib, and hoping for the best, and I'm very happy to be here, and welcome to all the new people.
Do I have any back row folks? Yes, no? Nobody wants to talk? Yeah? I just need a mic down here at this end. Here we go.
Anybody want to talk in the back?
Yeah, I'm coming down here.
Okay.
My name is Sarah. 2.5 months ago, I was diagnosed as having a stage 3A lung cancer, and it was like the sky is falling down on me. It was very hard. This is first time I'm here, and I'm happy to be here meeting people have the same kind of disease as I have, and knowing that everybody's happy makes me feeling better. Thank you.
It is wonderful, isn't it? My name is Tekla Hammond. I'm here for the second time, and I was diagnosed in November with stage 4 small cell lung cancer. I'm in treatment at UC Davis, and so far it's going well. Thank you, Bonnie.
I'm Doug Lipinski, and I was diagnosed in July of 2014, and I'm non-small cell stage 4, taking Tarceva, and it's working wonderfully for me. And I'm really excited. I get my treatment at UC, so excited to hear what you have to say.
Where did you just come back from, Doug?
Florida.
Florida.
Florida
Nice.
for a week.
Nice. You travel when you have cancer. Wow.
Yes.
That's
In
great.
between PET scans, you can do all sorts of things.
Hi, I'm Susie. I was diagnosed with stage 4 non-small cell lung cancer in November. I'm currently taking Tarceva, and they just added Avastin in as well. That's it.
I'm Jeff. I'm Susie's husband, and I'm just here to support her.
Anybody else? No. No. Okay. Thank you, everybody, for sharing your stories. And as we kind of go out, as those of you who have been here before know, as we start talking, more of their stories will come out. And for those of you that are new, please understand that this is Q&A throughout, so you don't have to wait till anybody's done. Just grab a mic if you have a question you'd like to ask during the talk. And we will get it answered. Obviously, same thing goes for online. Andre, is there anybody online who wants to say hi to anybody? No? They're all just hanging out? Okay. Yeah. So with that, I think we'll jump right in and talk a little bit about, what the topic is, sort of the emotional impact and how to deal with it, and how it's sort of like this type of thing, right? From being diagnosed in the beginning and then moving through the process and the different sort of stages of that. So, Dan, I don't know if you want to open it with any opening comments or if you want me to just jump right in. Do you want to?
Well, I think I would love to be wearing a sparkly skirt right now and dancing around the place. It's so wonderful that you all showed up tonight to see a shrink, so we'll have to make it worth your while. One thing that really strikes me listening to all of you introduce yourselves is that cancer happens to people, doesn't it? I mean, sometimes, we can forget about that in the medical world, but there's really a person and a bunch of people around that person that's affected by this. So that's really my life's mission, is to really address the personhood and who we are and who we're meant to be, even as we go through what can be some of the toughest moments of our lives. I'm hoping that you'll, talk to me tonight and ask questions. Feel free to. My work at UCSF really deals with working with cancer patients like yourselves and family members all day long. And really, I think that across the world at this point, it's recognized that having supportive care while people are going through cancer treatment is super, super important. So our oncologists and our surgeons and our nurses and our social workers and our psychologists and psychiatrists are all working together really to help sort of the mind, body, spirit, holistic approach to helping people as they go through care.
So I think one of the things I'd like to do to kind of get this conversation started, just as a short little exercise, and this wasn't planned, it's just sort of happening, but maybe for those of you who would be interested in just shouting out some words and some sort of feelings about that you may be going through, whether it's, fear, sadness, anger, any of that, so that we can, I can take notes and we can maybe touch on each of those emotions or feelings. Anybody? No. Nobody? Vulnerable?
Vulnerable.
Anybody else?
I'm still in denial.
Denial. Guilt. Because I have an 18-year-old daughter who's very, very afraid of losing her mom.
Anybody else? Nobody scared? Nobody? Survivor's guilt.
Survivor guilt.
Mm-hmm. Fear is huge. I have stigma and unfair.
Anybody else? There you go. That's an emotion.
Angry.
Yeah.
Yeah.
Anybody else? Does anybody have to deal with anxiety? Anxiety.
Hopeless.
Unsupported.
What is it?
Unsupported.
Unsupported.
Uncertainty.
Helpless.
Sounds like it's, if you look at the whole spectrum of emotion for the human, right? Looks like there's a lot mentioned on this end. The hopeless and sad and fearful.
I have my mic's not working.
Beatable?
Nice, Rick. Somebody wants their old life back. Consumed. And grief over loss of health.
We are sort of concentrating on the negative, and I have experienced all of those, but I also have experienced an incredible amount of love.
Love.
Silver lining.
I'm wondering how many people feel in the room, and in talking to patients all the time, how many people in the room feel that a cancer diagnosis, regardless of the type, is all of these things, right? Scary, but how many of these things do you think are particular to lung cancer? Where might a lung cancer diagnosis be different? And it's things that I hear from patients all the time, and it's some of these things on here. It's the stigma, the hopelessness, the guilt. Yeah, right. So I think a lot of lung cancer patients have a different set of sort of emotional issues that go along with the diagnosis. You know, regardless of what smoking history may or may not have been, it's sort of tagged as that disease, right? Which is terribly wrong for a lot of reasons. Anybody else? Judgment.
Do people feel stressed? Do people feel stressed? Like a lot of, sort of a lot of pressure. Mm-hmm.
Acceptance.
Was that easily come to? Acceptance. It's a bit of a challenge to get to that place, isn't it?
So that's where I kind of wanted to go next, and I think this is something, Dianne, that you can help the group with. Is there a typical sort of route that these emotions take, or do they come and go? I know in doing reading, and I'm sure a lot of you have done reading, they talk about these different stages, right? Does that pertain here, whether it starts with shock and disbelief and then goes to fear and then kind of comes back and forth? How does that usually work?
So we have, I don't know how many people in this room and how many people online, and each person has your own style of responding to any stress that there is. So the complicated answer, because I'm kind of a college professor, is to say, well, there's not really a standard way that you're supposed to go from this to that to this to that. And I think the Kubler-Ross stages of grief sort of idea has been debunked to some extent. I think her work is pretty helpful, but it's also, we don't go through these specific stages like everybody else. But one thing that we do see is that in the very beginning, when you first get diagnosed, it can be really overwhelming emotionally. And so I think our natural tendency, which I think is a good tendency, is to kind of take in only as much as we can at that time. It's a lot to try to, if we really think of, for those of you who've been diagnosed, 4, 5, 6, 7 years ago, you have a bigger sense of the landscape of how much this disease can impact your life. But in that moment, it's just too much, I think, for us to handle. And so I think we do go into a pretty natural denial kind of space. And I think it's a mercifully healthy place to be for a little while, because it's just a lot to kind of take in. I like to say that, psychological time is incredibly slow. It's like in slow motion compared to medical time. Think about what happens after you get diagnosed. They come in, they tell you, okay, your scan showed this, and your biopsy shows this, and we're going to do this treatment, and we could do that treatment or this treatment, and we'll get a second opinion, and blah, 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 blah. But your psychological kind of appreciation for what's just been happening to me takes so much longer. I mean, you might be going through several months of treatment before you pick your head up and go, what? Could it be? Did I get diagnosed with cancer, and am I even going through this? I mean, it takes this time, and there are layers psychologically to how we kind of make sense of it. And so it's really kind of normal for us to go through these. I think you are showing this kind of wave of a roller coaster, because over time our system kind of starts to adjust to new thing, and then starts to adjust to new thing, which was why I responded to your word of acceptance as saying, that's not quite the easiest place to come to, is it? I mean, you've got to go through quite a few layers of understanding, and a lot of grief was mentioned over here. There's just some grief and loss that we take in. And when I talked about the spectrum of emotions, and we're all people, right? We're all human. So how many of us would love to get rid of the fear and the despair? And how about the sadness and the grief and the anger, maybe, some of us, right? And yet, because we're human, we also want to have the love, right? And we want to have the hope, and we want to have the ability to feel joy, and also see beauty, which is the lovely young ladies who are here with us dressed in sparkly outfits. I mean, we want to see that. And so this capacity to be able to feel all of our emotions is necessary in order to feel the good. So we have the bad as well. And that's some of the things that we learn to figure out, right, in this process, in this journey. Kind of how do you figure out, how do you live with, how do you go travel when you've got despair? Is it possible? Can you put despair in your suitcase and carry it with you and go travel anyways? Can you pick up grief and put it in your pocket and then hug your granddaughter?
Absolutely. Yes.
That's what we're all about. Mm-hmm. That's what we want to be doing. That's where the vitality is, right? And that's what you're all doing every day. And I guess you needed me to come here and give you permission, but that's what it's all about. That's why I'm in this work, and why I think it's important.
Can you perhaps tell them, I think they all know that, and they all see that and do that on a daily basis, but we don't always know how to get there. You know, their first instinct, I can speak for myself, was to just stay in a dark room and not talk to anybody, you know, until I got to the point where I felt like I could, you know, open myself up again to all those nice things, because you're afraid that you're not going to get there, that things aren't going to be nice again. So can you help, you know, talk about how to get there?
Bonnie, you were talking about how our thoughts, our mind, sometimes is our worst enemy, right? You know, I'll give an example of one of my patients who went out to Ocean Beach. You know, Ocean Beach, it's like gorgeous, big beach, beautiful Pacific Ocean, and she's watching the sunset. And instead of being able to take in the incredible beauty of this sunset with all the colors and the beautiful horizon, her mind comes in and says, but this could be one of your last sunsets. You may not have more. And she couldn't enjoy it anymore, right? The mind comes in and it brings us kind of this thought, right? Some other of my patients will kind of be, you know, playing cards in the living room with their kids, and their mind will come in, you might leave them. And one of my patients says she couldn't even play cards anymore with her kids. She went in her room and closed the door and stayed in there. So our minds can often be both our, of course, gift. I mean, my mind is working right now to generate words, hopefully, to help all of you. But at the same time, our mind can also kind of come in and sort of rob us of these wonderful opportunities. It kind of tells us, oh, don't feel the grief, don't feel the fear, you got to hide from it, and things like that comes in. Maybe, you know, your minds have your own little kind of idiosyncratic things. And yet, we sometimes have to do things in spite of our mind telling us negative things. For example, my mind might have told me on the way down here, you know, what are you doing going out there and talking in front of all these people? What do you have to contribute, my mind might say. And I can speak back to my mind and say, well, I'm going to do it anyways, and okay. You know, I'll just do my best, right? Because it's important to me, right? It's important to me. So we talk a lot in psychology and psycho-oncology, the field that I work in, about how to continue to kind of carry your mind along for the ride, but don't let those negative voices be the decider, you know? We talk about it, you know, who's really going to be driving the bus? Do you want you to be driving the bus, or do you want these kind of thoughts in your mind? Now, we can't squelch those thoughts. We can't get rid of them. Have people tried to get rid of thoughts like thoughts about the future, or thoughts, you know, negative things that might happen? How about if you're worried about scans, or you're going to go back and get a checkup, and you know your mind all night long is going, but what if this happens, and what if that happens, and what if this happens? And so you say, I just want to shut my mind up. Do any of you want to kind of shut your mind up sometimes? Well, we found from research, Daniel Wegner is a psychologist. He passed away a couple years ago, but he worked at Harvard, and one of the things he did was the white bear experiment. And in the white bear experiment, he had people come into the laboratory. I love psychological research. In my next life, I'll go back and work in the laboratory and run people through experiments. So he brings people in and he says, don't think of a white bear. Okay, don't think of a white bear, don't think of a white bear. And what do people do, right?
All you can think about is the white bear.
Well, some people had some success. They were able to suppress the thoughts of the white bear, okay, but not for very long, okay. And he found that the people that were told to suppress the thoughts of the white bear, when they were then permitted to think the thoughts of the white bear, they came flooding back at a much greater rate than the people who were told they could think of a white bear or not. It didn't matter. They weren't forced to suppress it. So the more we try to shut our mind up, the louder it's like it like leaks in like a leaky basement. You know, if you have a leaky flooding basement and you try to like block it off with, I don't know, duct tape or something to stop it from leaking, the water will seep in the sides, right? And that's what our mind does. It starts to kind of come in. The more we try to shut it up, the louder it goes. And so guess what actually helps with those pesky thoughts? Does anybody know?
Let them come.
Let them come, yeah. It's like a mindfulness practice maybe, or a meditation type practice. Anybody ever try that? Yeah, so we're finding that, lo and behold, like who knew? Of course, we all know because mindfulness is everywhere. You read the New York Times, it's out there. You walk down the street, people hit you over the head with mindfulness. So mindfulness is the big deal in psychology and in lots of things. It's good for a lot of things, but it's really, really helpful that we can work with our thoughts instead of against them. So when you're having those kinds of thoughts, they're coming in fast and furious, step back a little bit and just watch them go by. Kind of think about them as, you know, put them on a little train and let the train kind of go and just watch them and say that's a thought and that's a thought. And that's one technique to really help with that. Because what's really important? Not shutting the mind up, that's not the most important thing. What's important? Anybody have something that's important to them? What's important to you? Yeah.
Being grateful. Sorry, I have to say it out loud because you didn't grab it.
Yeah. So
Mary, even when she does that, it won't be loud.
But within the gratitude, like for example, were you grateful for something today? Or yesterday or last week?
Yes, I'm grateful tonight talking to one of our people here.
Yeah. So people, right? Somebody said love. That's important to me. Love, right? Loving certain people, right? Like my daughter, that's important to me. What else? What's important? What's important to you? Yeah.
I'm grateful every morning when I wake up and the Tarsiva is still working.
You're grateful to be here. To do what? To do what?
Well, today I went for a bicycle ride in nature, and I was rewarded by seeing a coyote,
Okay.
a turkey wide open, and a bunch of deer.
Awesome.
So I just feel like this is why I'm here, to observe this stuff.
Yeah, yeah.
You know?
And you know what? That's an awesome thing, to be here to be an observer of something so magnificent as nature. That to me, that's perfect. You raised your hand too.
Yes, what's really important to me and that really helps is keeping my eye focused on the resurrection. Because I like to read the Bible, and if you just find out what the Lord's Prayer says, what it means, all these things we've been memorizing for years. And, when my body doesn't work anymore, I go to sleep and I wake up with a new body in paradise. So it was bought for us at great cost. So that's my focus. And I very seldom get down because I know God loves us so much. So that's all I need.
So you have a purpose and a meaning and exactly what you need to really, that your faith and your faith in God.
Yeah, because all I'm going to do is go to sleep, When your body doesn't work anymore, you're in pain or whatever, you just go to sleep. Wake up, you don't know how long you've been asleep, and it's, a lot of people don't like to believe in it because it sounds like a fairy tale, but it isn't. It's really true.
So faith and purpose for you is very important. Other people, important things.
Gratitude is huge for me, but I don't know if it's what's important to me or what gets me through is faking it. I believe in faking it because...
Fake it till you make it?
Yep, because if I'm real and face all the terror, not only does it make me feel bad, but it pushes people away. They don't want to deal with anybody who's sad or terrified, even the people closest to me. And in fact, there's like a paradoxical reaction. So what works for me is just pretending that I feel great, I'm going to live forever. I'm an atheist. I don't have much faith in anything beyond this life. So I got what I got. And
honesty is a problem, too.
But honesty is, I can put that aside and to fake it. And to me, it works.
So what I guess coming back to the question, because thank you for sharing that. So what you're saying is that what's important to you is not so much giving in to whatever your mind is telling you to be fearful of. What's important to you is to being present to your family. Is that what I'm hearing? And that you will move into that goal with intention.
Right. Even if it means, I'm convincing my family that I feel great, that everything is going to be fine. And, it works for me. It works sometimes.
Okay. And that's a great thing to say, is sometimes, because I think one of the things that we have been blessed with as humans is a mind that has the ability to discern nuance. So what does that mean? I don't have to think just in black and white. I don't have to think in either I live forever or I'm dying right now, right? That's dichotomous, right? So there's all this in-between. So what I encourage you is to think about the in-between all the time. Our mind's going to go to the simplest explanation. Either she's great or she's meh, right? No, there's something in between. I'm partially okay up here, and I'm partially fumbling around, and hopefully my message gets through, right? And that's what most of our lives are about, right? We're not always perfectly 100% exactly perfect success, right? That's the same. So we give ourselves some possibility for sometimes muddling through and just kind of saying, you know what, I'm not going to give in to those thoughts right now and kind of get into that fear. I'm going to move forward and be right there for my family. And then at other times, it might be more appropriate to share a little bit of what I'm afraid of, some vulnerability. Somebody mentioned vulnerable over here. Some vulnerability, right, with certain people at certain times.
Are you saying that you really have to give yourself permission to...
That's a great word.
Yeah. To cry occasionally, you know? I think I know what you're saying, because what's that old saying? If you cry and you cry alone and you laugh and the whole world laughs with you. But it's not an either or, right? It's sometimes crying is a must for you, and sometimes faking it is a must.
Well, here's
and
an
they're
interesting,
both okay.
yeah, Bonnie, there's an interesting psychological, kind of fact, and that is that when we're vulnerable, people like us more. Isn't that interesting?
More real.
Yeah.
So I have a question. So I'm at this point where I'm a year into Tarceva. I did radiation in November, and I'm feeling pretty well, and I'm moving forward. And of course, I have 2 little girls that I'm taking care of, and this whole life that I'm, working towards, and working at Apple, and very busy with that. And when you reach a point where you feel like you're stable with this disease, and you're going to be stable hopefully for a while, how do you get past the point of feeling nervous about the next event that would come? And what would help you emotionally to get through that? How do you maintain a feeling of healing for that period that you're not worried about the lung cancer?
That's a really, 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 really good question. That's such a good question that we've been spending quite a bit of time in our research on that question itself. So you're asking, here you are at this point where you're well enough really to have the luxury now to have a good life that you're leading, and your mind's coming in and saying, how long will it last? It might not last long. What will happen next? See, the mind is so powerful if we let it be, right? And so one of the things I'm going to say is you've got an incredibly good brain. Your brain is doing exactly what it's supposed to do. I would routinely thank my brain for that. Brains do what brains are supposed to do, right? It's an organ. It's like the heart, or I don't know what the pancreas does, but it does something, and I'm glad it does, right? Because if it doesn't, I think it's bad. So the brain, what does the brain do? What does the brain do? It brings patterns together. It learns. It generates these thoughts. It comes out, it's almost like a crapshoot. It throws out all these thoughts, and if it sticks, then it's the right thought. If you really stop and watch your brain, there's a lot of kind of, artifact that it's generating, garbage or whatever, and some of it's good and some of it's partially good and so on. Well, your brain learned that the world is a dangerous place. Your brain learned very well, and it should have, that something significantly bad could happen to you. And, you evolved from mammals that, learned that and evolved to reproduce and come to the point where you are now, right? And if you're working at Apple, right, you've got a pretty good, you can pretty much learn from mistakes, probably, right? You've learned all through your life. So your brain learned. It basically learned. That's all I can say. It just said, now I know that something bad can happen. Now I know it could happen in the future. And that part of your brain, your emotional part of your brain, is warning you.
Yeah, and I think, Apple's a great distraction. My kids are a great distraction. Madison being a Girl Scout is, great. But there are these moments where, I sit down on the couch for that 1 hour at night and I'm like, oh my God, I have lung cancer, I forgot about that. Or I'll be in a meeting and I'll think, oh yeah, God, crap, I still have the cancer, or I could come back. Or, are there ways to, through meditation that you would calm your mind for a certain amount of length? Or
so there are some things. So the first answer is that your mind learned, and that's good. Okay, so that's the first answer. The second answer is, now what do you do with all those thoughts, right? Because that part of your brain is really just warning you, and it's hypothetical, right? It can't predict any better than a crystal ball, which maybe can predict, I don't know. But your brain can't really predict that well. It's just kind of saying, look, this is something to be concerned about. This is something to be alert to. This is something to be vigilant to. And it would have been good if there was like, a predator lurking, like a big cat around the corner or something, and you were a mouse. It would be really good that your brain was like on you like that. In this case, it's not that good, because you can't, other than following through on your medical visits, there's not a lot you can immediately do when you're sitting on the couch. But your brain doesn't, it's kind of, it's not a smart system. I don't know what the tech version would be. It's just not that, it's not that smart in a nuanced kind of way. It's binary, right? It's like either you're under danger, And so what you need to do is you need to figure out where to allow those thoughts to be, and that's a meditation technique. I mean, that's a strategy that we can learn in meditation. We don't have to do meditation to learn that, but it's a really good way. And it's sort of like letting, so your mind is generating a bunch of thoughts, and you kind of let them be there without squashing them or suppressing them, like the white bear experiment, right? But also not being terribly reactive to them. And so if you can allow yourself to be sort of less reactive to them, and that's a technique you can also learn, sometimes that part of the brain quiets down a bit.
Can I give you an example?
And sometimes it doesn't, right.
At night, and I'm sure we've all experienced this, you can't get to sleep because your mind is going crazy because something's happening tomorrow. It might be Madison's birthday party, or it might be, you have to go to work, or something's happening, and you're just like, oh, can't go to sleep. What I do, sounds crazy, I will email myself. I'll say, blah, 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 it's Madison's birthday tomorrow, everything's cool, everything's taken care of, stop worrying about it. Oh. And just that event, doing that, helps it get out of my head and into the phone. Right. I know it's going to come back tomorrow, but I get to let go of it right now. Does that make sense? Yeah. And I think if you tell yourself, I didn't think this way before I was diagnosed with stage 4 lung cancer. I didn't sit here at night or having moments during the day saying, oh boy, something horrible can happen tomorrow.
Yeah, and I think it's always different thoughts. Yeah. Like tomorrow I'll think about something else that will worry me, But
right.
That's the wonderful thing I tell you about the mind. We try to, we can deal with one thought. For example, we can argue back with one thought. It's like whack-a-mole, though. Yeah. We get like, up comes the other thought. So it's more like allowing the brain, that's a wonderful technique, just kind of saying, well, my mind's going to generate a lot of thoughts, and I'm going to let those kind of be there, and I'm going to kind of just sort of detach a bit from.
Yeah, I mean, I think when I go in for scans or I need to address an issue with the lung cancer, it just reminds me that I am ill, and so it's almost, I try to avoid situations, concerning lung cancer. Sometimes I don't even read articles.
Other people probably have this, right? I hear this all the time, that there are cues in the environment. So any kind of notice in the newspaper about cancer or lung cancer, driving near where you had chemo, or, all kinds of things can, somebody, wore a blouse when she went to get chemo. Now that blouse reminds her. Right? And this is again something that our brain does because it's actually an adaptive thing.
So it's kind of like an association.
Yeah, it's an association. So like when we're talking about the mammal in the woods again, if the mammal was attacked by a cat but then survived, the little mouse was attacked by a cat but then survived, whenever it goes anywhere near that area of the woods or smells anything that reminds them of that thing, or, the brain learns really well in the presence of those kind of stress hormones. And so you develop this, you have a great brain. It does what it's supposed to do. Now what should you do back? Because you're in charge, not that part of your mind, right? You're in charge, is that you can not avoid some things. That helps, actually, if you kind of push back into what you're afraid of. It actually helps a lot, and that's a longer conversation.
So is it something, though, like I'm thinking along the lines of actually what you're saying is looking at and recognizing the negative thought or the scary thought or whatever, and then making a conscious decision to talk back to that thought, so to speak, right? Is that what you're saying? And if your brain is so good at learning things, we technically, and I'm guessing, should be able to teach it to not listen to those things that are making us uncomfortable. So, at the times when we know it's not an imperative situation. Do you know what I mean?
So, it's a little bit more complicated than that. And let me see if I can make it kind of simple for you. If your mind's generating the thoughts of, tomorrow there's a scan, and what if it shows that cancer's come back? Anybody ever have that kind of worry?
It's called scanxiety.
Yeah. Scanxiety. And then what's the emotion that comes with that? Nervous or worried or depressed?
Anxiety.
Yeah. Okay. So you've got that thought, right? And one way of dealing with that is to kind of let the thought be kind of over here, because the thoughts are going to come fast and furious, and they're going to be, some of them are going to be helpful or predict a true future, but you have no idea which ones, right? So they're really, so arguing back with them doesn't help, right? And so we're just going to put them there. One technique that you could do is just kind of write them all down on a piece of paper, maybe in an email to yourself.
Email yourself.
Right? Write them all down and put them over there. And then let the anxiety be with you and do some kind of breathing. So when we welcome emotions to be there and we don't put any kind of limit on them, the emotions actually kind of move through. Has anybody ever noticed that? Has anybody ever tried that? Kind of let the anxiety, yeah. Sure.
Doug, grab a mic, sorry.
The only one that doesn't seem to go quickly like that is grief.
Grief stays a little bit longer, yeah.
But the other ones will pass if I let them.
Well, and one of the things that our mind tells us is don't feel those emotions because they're going to pull you into this pit that you can't climb out of. Does anybody ever have that thought?
Yes.
And so as we do battle, we're not just doing battle with our mind, we're doing battle with the thoughts that our mind's telling us not to have these emotions, not to have the anxiety, not to have the fear, not to have the sadness, right? Whereas if we actually kind of breathe into that and let that fear be there for a little bit, it stays for a little while, and then we focus on something else. Anybody ever notice that?
It might sound crazy, but it's really good to have a journal. And when you have moments like that, just say, you know what, I have to get this out. Mm-hmm. I got to get it out because it's whirling around in my head and it's making me crazy and I can't sleep and I can't cook dinner and I can't go to work and I can't do this. So journal it, stick it in there, date it, write it down, swear at it, yell at it, be pissed off, do whatever it takes to get it out of your head and onto the book. And close the book, put it down and get up. It helps. It really does.
That's great. Bonnie, have you ever looked back at that
I did
journal?
it. I did it, and I read some of that and think, oh, wow. But I love reading it. I do. It's like, wow.
So one thing that helps you do is what we call perspective taking. So, you have this perspective. You're thinking of Bonnie there then, right?
Mm-hmm.
Bonnie there
Absolutely.
then, sad, upset, mad.
Yeah.
And that's different than
right.
here now, Bonnie here now, right? And so you can start to kind of on a visceral level, just to like, and that's really how that part of the brain works the best, is when we do things, not when we talk about them, not when we try to reason with our brain, but when we do things. And when we look at that journal and we say, wow, she was really upset then. She there, over there then was really upset. And here I am now, not nearly as upset, right?
I read a book a long time ago, and it was how you took little Molly, when Molly was 4, and you kind of get in touch with little Molly and put little Molly on your lap and just say, you know, sweetheart, I know you're scared, and I know you're really having a bad day, but I'm here for you. And it's crazy, but it works. It works because sometimes little Molly needs that. You know, we're all walking around as adults all the time, trying to be adults and trying to be brave and keeping all of our fear away from the people we love and not scaring anybody. But inside, we're terrified. So you have to get in touch with little Molly and make her feel better. You know, it's a process, but it works.
There's another, and that's kind of leading up to my next question is, you know, when friends see me and they say, oh, you look so well, like they're completely surprised. Wow, you look great. I mean, you're not sick at all. And so obviously they don't know what's going on inside. And, you know, what sort of things do you tell people? Because they, you know, how are you? Are you okay? And you're like, oh, God, I'm all right. I'm here. I'm standing here.
People say the darndest things, don't they?
Exactly.
I mean,
is there a line that you can, like a candid line?
Well, as my 13-year-old my 13-year-old daughter would say, awkward. You know, I mean, you know, people don't really know what to say. They don't really understand, right? And they try to understand, they try to, you know. And so one of my patients gave me a great idea, and I have suggested this to everybody that I meet. When people come up to you and they're saying something to you, instead of listening to what the words are that's coming out of their mouth, you know, when they're trying to express concern for you, pretend they're the Charlie Brown's teacher, and they're going, rah, 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 rah. But listen for the love. So don't listen to the words, it's but listen for the love. Because they're coming, they don't know what to say, and they're coming with some concern for you. And so that really helps, because I don't think we can, I mean, we've talked about this over and over again. I'm not sure we can teach everybody to say the right thing. It's just,
you know, the funny
it's
part
not
is
working.
I'm never offended if another lung cancer patient comes to me and says, "How are you?" Because I know they know what they're asking.
Which is why
this
this group right here is so vital for us.
Yeah.
Yes.
I'm glad. It's interesting that you're not recommending chemical changes to your brain. You know, when I was first diagnosed, the terror was so great, and I wasn't sharing it with my daughter because it was the holidays. She was in finals, and I couldn't stop crying. And so I did start taking an anti-anxiety drug or an antidepressant or something, one of them. And I think it worked for a while, but it also just made me feel really kind of dull and stupid. And I'd rather be alive. I'd rather feel, even if it's not the greatest feelings. I want to be in touch with them. I don't need the edges to be completely blurred. But sometimes I think what a great escape it would be, you know, in a way, to just kind of chemically change your brain. But I'm glad I had that experience, left it behind, and I'm not really that tempted ever to do it again, but I think for some people it is helpful. I don't know.
So I'm a psychologist, so that means that I don't have a medical degree. I don't even play one on TV. And so I use behavioral approaches to shift people's, you know, emotional states or deal with their thoughts or shift. We do a lot of things to help with pain management through behavioral means and sleep strategies and all kinds of stuff. So we can do a lot of things through behavior, and that includes shifting brain chemistry in ways. And some of the most powerful approaches for that are loved ones. So social support is probably the most powerful. We could bottle that. It would be a blockbuster and then some. 30, 40 years of research on social support. If you've got somebody in your life that loves you and is near you and nurturing to you, you're going to have lower morbidity and mortality from all kinds of sources. And that includes survival from cancer. So if you've got good people, and you've got close people, and if you've got touch, your immune system is improved. So there's a lot of behavioral things that really work. But many of my patients take things like antidepressants and sleep aids and anti-anxiety medications. And so a lot of people benefit from them.
Can you talk on that point, can you talk a little bit about, I was telling some folks tonight about one of our other patients that's, I know, dialed in here, and they're going to know exactly who I'm talking about. They asked me a couple years ago, you know, how do we talk amongst our family and share what we're all afraid of? They're probably dialing in right now. Okay. How do we go home and sit down and tell each other, our spouses, our loved ones, our children, how do we sit in one room in one day and all look each other in the eye and say, this is what I'm afraid of. If I lose you, I'm going to be here alone. And the person that's sick says, I'm not only afraid for me, I'm afraid what's going to happen to you if I'm not here. And to have this conversation in a room together where everybody feels totally free to say exactly how they feel. I know in my family, I knew they all cared, but we never had that conversation. And we were always walking around on eggs. You know, we don't want to upset mom. Mom doesn't want to upset the kids. I don't want to make my husband worry. And so we all do it. And I think if we can get past that, we can get past a lot, because you should be able to say that at home.
And I think from a caregiver and loved one perspective of that, and I obviously I can't speak for the patient, but it stems from a place where to have that real conversation makes it more real and makes the reality that there was a possibility that she wasn't going to be here real, and that's not something any of us were prepared to look at. So it's like, well, as long as we don't talk about it, I guess we don't have to worry about it, right?
But we're all bottling everything, and that's making it all more difficult.
And that conversation is going on online right now, where a survivor asked, you know, do you ever feel alone, that your kids just don't care anymore? And so I jumped in and said, well, it's not because we don't care. It's because if we avoid the whole problem, you don't have cancer, pretty much. It's our way of healing. But, you know, Mom, to look back when you were first diagnosed, Danielle, Jared, and I, we had our little powwows because we don't want you to worry. We wanted you to take care of yourself. But we talked about all those things, you know, that we should have done together as a group, ultimately.
It's got to be in a group, because that's where you can all be whole again and live and laugh and cry and do go through all of those emotions that we all go through every day on any other occasion for any other thing, right? It's so healing. And then you can move on. Because then Molly could say, Arash, I'm having a moment, you know, and he could go, okay, let's go out and howl at the moon together and, you know, scream out how pissed off we are about this. And then it's like, whew, okay, let's go in and watch a movie. You know, it's not going to be with you the whole night or the whole day. It's going to be a passing thing. So
I'm really glad you brought that up, because I see that all the time where, especially like spouses, they'll each be grieving, but they won't want to share with the other person because they don't want to, you know, they want to show a brave front and so on. And so, you know, family members will be grieving privately, and it actually drives the family further apart rather than what you really want, right? I mean, I started this conversation, right, with this, what's important to you? Like, what's important to you? What's important to you is the well-being of your family members, right? I mean, mostly. I mean, what else is there, right? That's what's important to us. And so if coming together and spending that time with each other while you have life, when life is precious, if that's your goal, then kind of keeping this private grief driving you apart. So how many here would want to do that with your family, would want to kind of sit down and really share? It's a little daunting, isn't it? It is. It's scary, yeah. I mean, it's a lot of emotion in the room. Maybe even some old stuff from back before, right?
Yeah, no, I have 2 kids and a husband, and they don't want to hear it right now, or at least that's what I feel.
You might be surprised.
You know, every time I mention anything, oh, you're going to be fine.
Mm-hmm.
So I just
That's a good friend denial again, right?
Right.
Yeah.
They're scared.
Yeah.
They know.
Yeah. So there's a psychiatrist from Australia, Dr. David Kissane, and he's come to UCSF and presented and taught us a technique of family therapy that he developed over many years and tested with families. It's called family-focused therapy for cancer survivors and family-focused grief therapy. And basically that's what the focus of the therapy is. And you work with a facilitator and brings out kind of the family story, which is really important because how we interact as people within that family comes from what kind of families we grew up in and then what family we brought to our current family. And then talks about what people are feeling. And the families become incredibly close as a result of that.
I have, I grew up with 7 siblings, and we did family therapy before, like this is over 20 years ago.
Mm-hmm.
And it was amazing how people talked about what bothered them about the other person, and you think there's going to be all this conflict. And it just helped us throughout the rest of our lives, we were just... It was a real gift. And I think it's a hard thing to do because you have to really be committed to come to those meetings.
It's hard to get everybody in the same room on the same schedule.
Yeah.
Yeah.
And my brother was going through rehab. So that's what first initiated it.
Have you stayed close since then?
Yeah. Very close.
So I just wanted to say that this place here is incredible. Talking about anxiety, I had doctors that I just really didn't have good opinions about, and I was really worried if something else happened to me that they are not on top of it. And I come here and we got Bonnie traveling the whole world for us, and she knows everything. And if we had to pay a doctor to get this much information out of them, they'd charge us like thousands, if and so she has taken my anxiety down to practically nothing because I know she's got my back and her whole staff and her whole family, and they're so wonderful. And what do I have to worry about? Because I can only do so much. I can only think so much, go so far, with all this stuff. But she keeps going for us. It's just incredible.
So there's a
team.
There's something that, excuse me, that you said early in this conversation. You talked about understanding the layers of the psychological journey. And I'm guessing that we've covered some, but maybe if we could talk a little bit more about what those layers are.
Somebody mentioned survivor guilt.
Sally?
Yeah. I mean, you've got, this is cancer's that wonderful computer adaptive test that, just when you think that you've got it kind of beat emotionally, like you got this psychologically figured out, it kind of morphs to give you a different thing to kind of be worried about, I mean, so you deal with the first diagnosis, and that's hard, right? That's probably, people say in the research that it's probably the most difficult time when you first get diagnosed, and then between that and you have your treatment plan during that uncertainty period. Somebody mentioned uncertainty. That's really, you don't know anything about it. It's like you're starting a new college tomorrow, but it's not a college where you're getting the degree you want, right? It's like you have to go to this new medical system. You don't have any idea, So that's hard. But then as you go along, you get hit with lots of different things, right? It's not just one stressor. One of my patients said, I wish that it was like breaking your leg, and you broke your leg, and then you get it set, it heals, and then you rehab it or whatever, and you go on, right? Is cancer like that?
No.
No, you keep, you get the diagnosis, then this treatment, oh no, maybe not that treatment, this treatment, then you do this, then you do that, should you hopefully survive, then you're faced with this kind of period of stability where you're not sure, is something going to come back? When is it going to come back? And why me? Why did these wonderful people I loved at my support group, why did they die? Why am I alive? You've got this grief and so on.
My initial survivor's guilt started with the living room when it first started. I was the oldest person probably here. I had the best prognosis, and I had a hard time dealing with meeting. I'm going to get weepy now. Bonnie knows I cry at the drop of a hat. I had a hard time dealing with younger people that did not have good prognosis. And here I am in my senior years, my twilight years, so to speak, and I'm the one that's doing well. But the interesting thing is today I was talking with a friend who's had not lung cancer, but very severe, different type of cancer. And we were talking about how people react, and the people you least expect to be there for you are there for you. And the people that you think you're the closest to, they're not there. They're not there emotionally. And we decided kind of between us that that they didn't know how to deal with it, that in their own way they were there for us, but they didn't know how to show it to us. But I must say, through the living room here, I've learned a lot. And my big thing in life now is to try and give back in some way. So it's been good for me. It's given me a mission in life. And I keep saying something good came out of something bad.
I love that. I love that example of something good coming out of something bad, and that survivor guilt bringing tears to your eyes, because when those tears bubble up, oftentimes it's because it hit that sweet spot of what's really important to us. And for you, it's really important that caring for those younger cancer patients, cancer survivors, those caring for those folks, and how can you do something in the service of that? And you're here right now, and your presence is doing something in the service of that, I think, isn't it?
Well, I don't deal with the survivor's guilt like I did in the beginning. Now I'm thankful I'm here, and whatever I can do to be of service to someone else.
And I think that's interesting. So that's I think that's a good example of layers. Because as you sort of shift through, as this psychological time passes, and you looked at your journal and you wrote in there, and you had those emotions, and then you can kind of look back and you can say, wow, because my brain's so good, I learn that kind of emotions come and go. And I learn what I can do with that, what's important to me, that I can actually do something meaningful with it. Do other people feel like they found something kind of meaningful, a purpose through this process for themselves? Yes.
One interesting thing that happened was when I was at the lowest spot, I was getting all sorts of recommendations from my friends, but one that made a lot of sense was a book that talked about changes that you can make in your life to help your body deal with the cancer. And I was able to make changes like not eating a bunch of sweet stuff after dinner or all by itself, like that. And I had been trying for decades to stop doing that so much. And all of a sudden, I got to this point where I could make some really significant changes like that in my life. So I see that as a real silver lining of this whole thing. And it makes me feel a little bit more like, well, what other things do I want to change? You know, like now I'm working on being more patient with my wife. Because
That's always a good
I
thing.
figure at some point I might get really sick, and I'm going to want to be a nice guy. And I want to start now working on being a nice guy.
I hope she doesn't listen to this one.
That's great. That's exactly, I mean, you start to realize that almost anything is possible in a sense. It reminds me of this book by Larry LeShan. Has anybody read that, Cancer as a Turning Point? It's this sweet book. It's classic. It's very old. Have you read it? And in this, psychiatrist, Lawrence LeShan, he's working with cancer patients. This is, like I said, this is at least 30 years ago. And he asked them, you know, what is your song to sing? What are you here on this planet for? And now that you have cancer, does anybody here, do you ever use your cancer pass? You know what a cancer pass is?
Oh, yeah.
You sort of get away with stuff because you have cancer, right? Some people will not use their cancer pass no matter what. I'm not even gonna use a disabled placard, they say. But other people are like, yeah, you know, let me get that wheelchair through the airport so I don't have to stand in the TSA line. Whatever it is that you get.
Or not clean the garage.
Yeah, exactly,
Right.
exactly.
No, I can't today.
So what Dr. LeShan said is, you know, hey, you've got this cancer pass, you've got this excuse. Now, you know, now you don't have to, you can be polite to your wife and patient. Because you just can, because now you've got an excuse. You don't have to be that old way that you always were. You can be something totally different now. And so it's a sweet book if you pick it up. It's nice to read because there are the stories of these different patients. And, you know, one woman took singing lessons and, you know, I mean, but just for the first time in their lives, they felt like, hey, I have a reason now to do something real. You know, something really important. And it doesn't have to be something, you know, really big. It could be something tiny, like just looking at a coyote, you know, out on a hike, you know, and that's profound in its own way. Other people have ideas that you came up with something that kind of sang to you, spoke to your heart?
I talked to a new patient today, and he's a young one. And he started a caring bridge. He was just diagnosed in December. He started a caring bridge, and he had 400 people log on, and they're sending him notes every day. And he said, I didn't know that many people love me that much. You know, and he's really loving his caring bridge, and he's turned it into a blog. You know, so every day he gets on and kind of talks a little bit about his life, and you know, he's getting great feedback, so that's nourishing him in a big way.
Yeah. It's interesting, too, that's beautiful. It's interesting, too, this idea that these angels come from the periphery. Like, we think our closest friends, like our best friend's going to show up and take us to chemo every time. But then some neighbor down the street that we barely talk to says, oh, they want to come and bring food every week. You know, and you start, and you bring these new people into your world that you didn't think would be there.
Well, you never would have known them.
It's one of
you might not
those
have ever
interesting
known
things.
them or met them. Yeah. I know I wouldn't know any of you in this room if not for this. And I cherish each and every one of you. Just blessed to know you all. It's crazy. Honest, truth. You feel the same?
Absolutely.
Yeah.
We got onto this side of the feel-good emotions. We started with the negative emotions, now we got over to the feel-good. But I don't like to live over here in only the feel-good emotions either. I like the full range of emotion. I think that's more real, isn't it? So even while we don't want to just cheerlead and be like the person on the cover of the Cure magazine or whatever that's like doing the marathon, you know, those people, and saying, I'm a hero, I'm always positive, you know, because I'm cancer, you know, conqueror. Because none of us, we're human. If we've got a good brain, we're going to be experiencing those range of emotions. So I want to make sure that I leave you with the message that all of those emotions are all good. You know, it's all who we are.
What do you know about any research that has been done, or you personally know about what the mindset in that range, what sort of role that plays in the health of a person, the physical health?
There's been a lot of research. Some of it has come up with, so the question is, does the mind heal the body, or is there a bad emotional state? Is that what you're asking?
Yeah.
I think what the research is, if I could kind of summarize it and sort of summarize it badly, remember that anytime you kind of give a general summary statement, it's never going to really capture the truth, right? It's just going to be kind of is that it's really, this is my bias. This is my bias and my read of the literature and my work. And this is my interest, by the way, mind-body, like how our minds and bodies influence each other, right? Our mind influences our body, and our body influences our mind back. In fact, they said, you know, your gut is a bigger mind than your mind. There's more serotonin happening down there. Your mind in your gut? What? They also say you have a mind in your heart, like there's a nervous system, like a real, kind of brain almost in your heart. So there is no, separation between the two. There's, when we get stressed, hormones go flooding into our brain, neurotransmitters that a lot of them, when we're stressed out, cause even more of the thoughts to go zoom, 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 right? So there's a lot of interplay back and forth with mind and body. And that is a true thing. And we know that from science. But what's the best thing we can do for ourselves in that? And what's the difficult thing? Well, we know that to some extent that certain kinds of stress and certain kinds of prolonged stress can be detrimental to us in multiple different ways. And there's lots of pathways for that, both physiological and behavioral. So we know that there's this stress thing. And sometimes what happens is that people misunderstand this negative part of the emotional range, and they equate that with stress, right? And so they want to stop that, and they want to block it off, and they want to only have this side, and then they don't want to have those thoughts too, and they do the whack-a-mole with the thoughts, right? And what that ends up being is it ends up being a lot more stress because you can't live without those negative emotions, right? And you can't live without your brain generating thoughts. It's all going to happen. And what you end up doing is you end up putting yourself in a situation in which you're constantly failing. You're constantly chasing your tail, and you're constantly running from your tail. And that's a stressful scenario. So what I want to say is it's the struggle we want to let go of. We want to hold those things lightly in the palms of our hand like a butterfly. And you could try this yourself if you want to. You can just put your hands up in this kind of a posture. And then you can change, if you want to try, if you're willing to, put your hands in this kind of posture and just feel what that feels like to just kind of be like that, right? And now if you turn your hands over and you put your hands in a fist, and you're doing battle now with your thoughts, and you're doing battle with those nasty emotions and stuff. Ooh, feel that? And now you can turn, you've stopped. You didn't like it. You didn't want to keep doing it, right? Now put your hands like this. And now what I want you to do is just imagine, there's some despair. It's floating in your hand. There's some thoughts of negative stuff happening in the future that's floating in your hand. And you're just kind of breathing with that, right? Kind of like a yoga class or something, right? That's the state of healing. That's the state of mind-body healing. Is this kind of allowing these things to be there, kind of holding them lightly, and still moving forward with our feet into our lives. What's important? Talking to my wife. What's important? Going on a bike ride. What's important? Going to church, worshiping God. What's important? Taking care of these younger people that get diagnosed and they don't know what to do. Like, what's important to me? What's my heart wanting? While I'm holding just lightly lots of these other things that are coming along for the ride, right? And so it's the struggle is my answer that's not good for us. It's not, all these negative emotions and whatever they are, they're just being there. It's like grief. If you look deep into grief, grief has lots of layers of colors and interesting things in grief. I mean, look at grief deeply if you can. It's the most beautiful thing to look at. I look at it all the time in my work. I'm looking at grief with people. I'm looking at grief because I'm, afraid for people that I love who are my patients. I'm looking at grief all the time. Look at grief deeply like a painting and see what you see. I see love. I see so much love in grief. I see sadness, but I see nostalgia. I see memories of things, right? There's a lot of layers of grief in cancer, not just losing lives, but losing parts of our body and losing, opportunities and things like that. So hold grief lightly and breathe and move forward into what matters.
So I think that there are people in again, sort of how this started, right? People in various sort of places in their in the process. And I think, Yvette, you said it as like your new, right? And we call it the new normal, like learning to live within your new normal. And I think part of what Dianne is saying, I think this is what I'm hearing you say, is your new normal is going to include all of it and welcome it. And I think when Dianne, you and I had talked on the phone, and I've said here, and you've said here a million times over, allow yourself those moments, allow yourself the bad, sad days, right? And just don't live in them. But don't also live in the two sort of, this end of the spectrum, the two hopeful, positive, everything's great part either, because that's not good either. It's just
your mind won't let you live there all the time.
Yeah, it's just finding that balance, right? And
I'm going to say, be compassionate with yourself, because it sucks a lot of the time, and you can cry and you can be a baby and just, whine about it, and hopefully you've got some people around you, because that's really powerful, and hopefully you're getting out there and you're taking a walk every day, because if you're out there in the light in the morning with some movement, that I wish I could bottle that one, because that would be a blockbuster drug. Outside, in the light, with movement, hopefully with a friend or loved one, looking at nature, and you've got exactly the recipe for well-being and health, emotional and physical well-being. So you can, yes.
I just wanted to say, as a caregiver, I sometimes feel really helpless because I don't have any control over what's going to happen. And after you get over the initial explosion of what happens, then and then there are things come together, and then things fall apart, and they come together and they come apart. And that's the nature of life, whether you've got cancer or you don't have cancer. But when the things are together, I say to myself, well, okay, is there something, or even when they're not together, is there something that I could do that would be helpful to me or to somebody else? So, for example, I broke my pelvis, and I was really upset about that.
Wow.
And then I said, well, gee, I'm going to be laid up for 6 weeks or 8 weeks or whatever.
Or
this is an opportunity for me to do a lot of writing for helping with the foundation. So this is great. I can just sit in front of the computer and write, and I can grind out a lot of stuff. So, I don't have any control over what's going to happen. And I mean, today we had our first whole brain radiation therapy, and the start of 10 days. Okay, well, am I thrilled about that? Obviously not. But it's a darn good thing that we've got that kind of therapy, rather than slicing your brain open or not being able to have anything to help. So I think that the phrase I always come back to is that even in the midst of fear and ambiguity, you can move forward, and you get enough mileage on you. And I always say, well, millions of other people have dealt with stuff. I guess I will too. So
you've got some incredible flexibility. As psychological flexibility, we're thinking that's really the key, is being flexible. Saying,
right.
I can try on this new way of being because it's important to me. And I don't have to be the way I was yesterday if today, right now, contextually, this is the way I need to be. And that's pretty incredible. It's hard.
Well, it is not naturally
and you're not
who I
always
am,
good at
believe
it,
me.
right? But I think that's a worthy way of striving.
I would like to add one other thing, and that is I would to know the difference between being sad and being depressed, because they're very, very different things. And if you're depressed, I don't think that you can do this. And I'm not saying you should go and have chemically altering, medication or whatever, but there really is and I'm sure you know as a therapist, there's a really big difference between what you're able to do with behaviors when you're sad. You can do a lot, but when you're depressed, you may not be able to do that. So, so I think you have to kind of really be aware of that and seek out the help that you need if you are depressed, as opposed to just being sad.
Yeah, I want to say that my hope is that every single one of you has access to somebody like me, or a psychiatrist, or a therapist, a marriage family therapist, and that you have access to somebody who knows how to really walk the walk with you, that can partner with you. Isn't somebody who's also afraid of cancer, for example, and doesn't want to talk about it, and wants to talk about everything but cancer, or everything but dying, if you want to talk about dying, or if you need to. But my hope is that everybody who gets cancer has access to somebody who can help, not just with some of these strategies that I talked about today, but who can kind of say, wait a minute, this level of sadness or this level of depression is something that we really need to kind of pay attention to in a way that can turn that around. And we have a lot of really good evidence-based approaches to it, and we can turn it around. And depression is one of those critters that sits on your shoulder, and every time you have the opportunity to do something that would cause it to go away, it tells you not to do that. So your friend calls on the phone, and you could talk to your friend on the phone and laugh, right? And that would sort of make the depression get less. But the critter tells you, don't pick up the phone, don't answer it, you don't want to talk to anybody. Or if you could go outside and take a walk in the light, like I said, in the morning, the critter says, you're too tired and you don't feel like doing that, stay on the couch. So the critter kind of gets bigger by telling you to stop these opportunities that would actually help bring your mood up. And so it's a tough one, because when that critter's really loud and strong, we often do. We'll stay in bed, right? We won't answer the phone. We won't do the things we need to do. Then the pressure comes on. We get anxious because we didn't pay the bills, so on and so forth. So that, what I say is fight back against the critter. Do the stuff anyways.
Can we throw one more thing in the subject, and you just touched on it for a second. Amongst all of this, work, children, trying to keep everything as normal as possible, bills, medical bills.
I think somebody online wanted to touch on what Dianne was saying, and then we can jump over there.
So a loved one would love to know how to encourage his wife, who is currently going through a new diagnosis, how to seek support, how to encourage them to want to get support. He would love for her to.
Could I turn that question over to the audience or maybe somebody online? Because, I try to convince people all day long, but I think coming from your voices, what do you think would be an encouraging thing for somebody to hear that would help them get the support that they need? What do you think the right thing to say is?
I think one of the things that would be there for that person is to listen to what many of our patients here have gone through, how long they are still alive, because many of us, perhaps like Yvette has, just having it a month or a couple of months, we've gone to different sources, some of them being the internet or others, where we look at some very dry statistical numbers and we immediately apply that to ourselves and say, I have a month or 2 months or 5 months, or even if I'm on a treatment, this is how long it's probably going to last, and then that's my last hope. But when we hear from others who have gone through it and still are going through it, that they have experienced what we have, in that it is, in Bonnie's case, maybe 8 years, and in other cases, for Sally and others, it's 5 years, it's 7 years. Right away, it gives us some hope that there is finality, but the finality may not be as close as we thought. And hearing it from a group talking about it, or from an individual who is going through it and continues to think about it every day, can provide perhaps a little bit of hope that it may be different than what we've read, or perhaps a treatment that we've gotten somehow gives us a little bit of hope because it's taken away some of the symptoms, and perhaps we've gone past the 3 or 4 months, if that's what it is, devastation stage, and we say to our son, our daughter, or to someone else that all of a sudden they want to do a trip in a few months from now. So instead of thinking that I've now lived for 18 days or 25 days or 31 days, which I would write down every day and give it a number, and that was it. And I found myself, and perhaps others can also, it went from days to weeks to months, and now I really don't think about it until I come to the living room and say how long it's been. But I never would have had that thought in my head earlier on that in my case, so a little over 3.5 years, I would not have thought that that's possible until I heard some of the people here, and even though they've gone through some very difficult times, but their number was much bigger than I thought was ever possible.
I think part of the problem too in talking with patients is that they feel sort of stigmatized by the need for therapy, right? I know I've talked to several people who are like, no, I don't. There's nothing wrong, and I'm fine, and I can do this, and they're not. I don't think they understand the benefit of a group like this, and a group like this is fairly unique, right? It's actually really unique, where you're not sitting in a room in a scary place getting support, which is more depressing than it is hopeful and positive.
I think I can speak for myself, and only for myself. I thought it was a weakness to go to a support group. I really did. I never went to one the entire time I was being treated. And it wasn't until I was asked to speak at a support group, and I saw in that room there was no hope. No one in the room had hope, and I thought, oh my, we have to go. And Danielle was with me. I said, we have to go home and start a support group. And support might not be the right word, because that's not what this is. This is like Sunday dinner. We all get together and we do lots of different things. Today we're talking about the mind, and to your point, mind, body, and soul. It really is a trifecta. But, and to answer your question, Andrea, about how can I convince my wife that she needs support or help or whatever, don't tell your loved one you really need to get some help, right? Because that's going to go nowhere. What you need to do is do the homework for them. Line up a few potential things and say, I'm going to go with you You know, and oh, by the way, I already called your girlfriend and she said she'll go too, or your boyfriend or your guy friend or one of the people you walk with, Neil. And just say, okay, you know, choose one and then I'll set the date. I think that's helpful.
Well, one thing I say is, oh, I'm sorry, you were going to speak.
No,
Go ahead.
I was going to say, obviously, as I shared, this is very new for all of us and obviously for my mom. And my sister and I, right away, we knew that, you know, we needed to find, and you said it a few times, and hope. And that's all we wanted. We wanted hope. We wanted to hear stories of hope and encouragement, because social media is huge, obviously, right now. And that's the first thing we were doing. We were Googling, and everything that was coming up was all negative. So those first few days at the hospital when she was admitted, we were thinking, this is it, and this is it. And she was already preparing her will, and I need a will. And I thought, okay, this is it. Oh my gosh, she's gonna die. That's it. And then that's what we were thinking. You know, we brought our grandparents back from Mexico because I thought this is it. And then we realized, you know what, we really need to look for good stories out there, like good stories and hope. And that's how we came across this foundation and Bonnie. And as we started Googling and listening to a lot of the stories and in the living room, and I thought, this is it. And we put the videos for my mom, and I'm like, look, you know, let's do this. Like, let's try this. And I could see that she was kind of like, okay, you know, opening up to the idea, and I could see it. And I thought, you know, let's do it. And we felt it. And when I made the first phone call this morning, and Andrea answered the phone right away, that you can feel the encouragement. And I think that's what I would advise this person. Just find hope, people that give you hope and give you a sense of looking for the future in a bright light and positive energy. And I think that's what you can hold on. And I say with just this, you know, they can take away a lot of things, but they can never take away your faith and hope in people. And again, as I look across this room, I mean, wow, I mean, I am inspired. I am not only inspired, but just hopeful that this doesn't have to be a negative anymore. You know, this could be something very beautiful. And you know, I've heard it, journeys, and I keep thinking, you know, and I hear the journeys, and it's a journey, and there is a lot of beautiful things that I guess can happen after something like this, and I see it with all of you, with you. And so that's what I would say. Just find a good people around you. Surround yourself with good, positive people that give you good encouragement every day. And I think that's the most important thing. And I think I could see it in my mom. I could see that you seem good, right? Yeah, okay, right? I hope.
My faith, and that's it's helping me a lot. And as I read the Bible, and I will win either way. If he calls me to his presence, or he gives me many years. So I'm in peace. Yeah.
Nice.
Anybody else before I move to the... So I don't know if you want to repeat your question. We have like maybe 5 more minutes before. Do you remember what it was?
No.
I don't either. So I did have one more question that we didn't get to, and it kind of goes on the caretaker thing. And when Evie was talking, our caregiver thing, it reminded me that, you know, a lot of times what I'll hear from caregivers, and it might be another question that we pose back to the group, but it's that, well, my bad day isn't worth coming home and talking about, right? Because his or her cancer trumps my bad day every day, right? And so how the caregivers sort of are to deal with that, right? Because I think there's a different set of needs, right?
Well, you know, and that's really a great point, Danielle, because if you segue back to where we were, you know, an hour ago, talking about pulling that family unit together and being really honest with each other. You know, the caregiver has bad days too, and they need to come home and tell their spouse or their loved one or their kids, do you know what happened to me at work today? You know, you need normalcy. You need your life to be as normal as possible to get through this. You know, you don't want to be walking on eggs and tiptoeing, you know, around.
So I guess that's the question to the patients and the caregivers in the room. You know, do you feel like you can't talk about your bad days to the caregivers and to the people, you know, dealing with and living with this disease? Do you want your loved ones and caregivers to tell you about their bad days, or would you rather they not? Anybody have any comments on that?
So I was given some really good advice when I was first diagnosed, and I was so consumed with myself and trying to figure out what this was that I had and what my treatments were going to be, and I didn't think about Arash or Madison or Dylan. And someone pointed out is you have to let Arash have a bad day and think that cancer sucks, because it does for them, and they don't know how you're feeling day to day. I mean, you know how you're feeling. You're kind of gauging it with the medicine and the treatments, and some days you have bad days and other days are okay, but they have no idea what's going on in your head at that moment. So, you know, I let Arash have those crappy days, and if the kids want to say, and well, my kids are little, so they'll just have a tantrum. But you know, it could be related to that mommy wasn't feeling good that day. So I definitely like the idea of having the family therapy sessions, because you got to let it out. And we have found that really helpful in the last year.
It'll bring you closer. It really will.
Yeah.
Yeah. I remember one time, a long time ago, we were having Sunday dinner at our house, and I cooked the dinner. I was bald as a cucumber, had a little rag on my head, whatever. And then it was time to do the dishes. And of course, when my kids come home. They're relaxing, you know, after dinner with their full tummies and everything. And I'm doing the dishes, and I'm thinking, and I felt fine, actually. But I just turned the light on and off. You know, and I said, "Excuse me, I have cancer. Does that mean I have to cook and do the dishes?" So they jumped up and said, "No, we'll help. But, you know, that's the cancer card. But humor too, you know, and you have to be able to do those things. You have to stay normal. If you're a sarcastic family, you have to stay being a sarcastic family, because that's what we expect, right? That's what we expect in our family. Stay as normal as possible, because that makes it real for everybody."
Well, that's why I came over and still asked you to make me a cup of coffee.
Right, exactly.
I didn't want you to feel different.
Exactly.
I was just, you know, I was just struck, you know, with this theme from the beginning of, you know, doing what's important, kind of stepping up, you know, being more patient with your wife, you know, being more loving to your kids, you know, you know, giving your mom some way of kind of having a bright spot, you know, just what is important, you know, to you. And it struck me that, you know, probably when we're cancer patients, if that's what we're called, we want to kind of give our spouse a break too sometimes. We want to kind of be patient. We want to be a good listener. You know, years ago I worked in spinal cord injury. And one of the things that, you know, I thought, oh gosh, you know, you get a spinal cord injury, your life's never going to be the same again. And then I learned that people can really blossom through that process. Oh my goodness. But one of the things that you can do, even when you're kind of laid up in bed, is you can be a really good listener, you know?
Yep.
You know, you can always find something, right?
Right.
Yeah.
And I think it's important that on the days that you do feel good, please tell your family. Let them know. It's a relief for them. They need that relief. They need to know that you're feeling okay.
Yep. And they need to know when you're going to need to lie down. And that's okay too.
Or
it's
have
all
the
okay.
dishes done.
Or do the dishes.
But my husband does all the dishes, so he's
wow. Wow. I'm very
And he
proud
does
of
laundry.
you. Right, laundry too. Where's my husband? Where'd he go? He left. He probably heard we were talking about dishes and laundry.
He went home to get the coffee ready for tomorrow morning.
That's right.
So I'm getting sort of the 10-minute, you know, to the end wave from the corner. So I don't know if anybody has any closing thoughts or anything they'd like to say, other than a huge thank you to Dianne Shumay for coming down and talking with us. Everybody online?
Nobody has any
No?
closing comments?
I would be curious if anything's like some ideas have come to you about something that you might want to do differently after tonight? Something maybe that you want to kind of try on for size, something that is important to you? Anybody think of something that they'd like to kind of try?
Definitely doing the journal.
Nice.
Excellent.
Okay. Oh, yeah.
Good.
Email me.
Yeah.
I'll hold it for a while. I'll hold it for you.
Anybody thinking of kind of ways that they can relate to their family?
I
Go
will
ahead.
start taking that walk in the morning.
Okay.
And I live by the ocean, so try
Okay.
to
There you go.
admire
That's
the
awesome.
ocean and spend more time.
That's awesome.
there.
That's awesome. Yeah.
Good. You get a gold star for that answer. That's awesome. Anybody have any idea of ways to be with their loved ones a little bit closer, a little bit deeper? Share something more.
There's meditation.
Meditation. Excellent.
Yeah, I'm going to second that because I actually go to UCSF
Uh-huh.
and took James Michener's meditation
Mm-hmm.
for, it was a long one, it was like 8 weeks. And it was 3
good.
hours every Thursday.
MBSR. Yeah.
Yeah,
Mhm.
and it was all through my treatment last year.
Mhm.
And everything we discussed tonight,
Mhm.
my mindful meditation really, really helps.
Wonderful.
You address it, you address
Mhm.
the fear, then you
Mhm.
just let it go.
Yeah.
And living in the, and when I say this, I mean moment. When you're doing the dishes, you say, okay, that's the soap. And I'm like one of those type A people that never lived in the moment. I was always, 3 days ahead of what I was going to do. It's been saving my life. I figure it's equally as important as the chemo and radiation I went through.
And meditation's easy to get lots of meditation around. The mindfulness MBSR programs. There's Monday meditation drop-in. It's free at UCSF if you want to come to the Cancer Center. Yes.
I read someplace that, and I think I may have said it before, meditation is like having a blind date with yourself. And
Okay.
I really think that's how it is. And the other thing I would just like to say is, I look at how I'm going through what we're going through when he's going through it, and I say, well, how you doing with, and I have to say sometimes, you're doing damn good. Damn well. And other times I say, well, you really could have done a better job there. But say to yourself, how are you doing?
Yeah.
And most of the time, I bet you'll say, okay, I'm doing okay.
I have something I'd like you all to practice tomorrow morning. When you get up and you're ready to go for your day, whatever that is, look in the mirror and tell Cancer you're not taking him out with you today. You're leaving him right there, and then leave.
Great. Well, thank you so much to Dianne for coming out. You brought some stuff. Did you give it to Michelle? Were you able to bring some collateral or some information?
I'll send you
it to
some
me.
things.
Okay, great.
There are a lot of resources that, if you're interested, I think are good.
Good. So that'll be great. And I of course, have a couple of housekeeping things.
You have some announcements, too.
I do. I think we talked about our special, that's not it, our AYA series. So next week we have another living room of sorts. We've got Dr. Gitlitz coming from USC, her and Stephen Young, and Ben's going to be here, and Corey, for some of you who know her, Chris Draft. Who am I forgetting? Oh, and Sandy. You guys haven't met Sandy yet. Well, some of you have because she was at the gala. She's a young lung patient from San Diego. So they're coming up, and we're going to talk a little bit about the genomics of a young lung, about their experience. And I think it's important that you guys know that, one of the hopeful discoveries to come out of this alchemy study is, what might we find in a young lung patient that we can then use in treating all lung cancer patients. So it's a really important study. It's something that's never been looked at before. So I hope those of you that can make it will come. It's at 5:30 on Thursday. Yeah, the 26th. I just wasn't sure about the date. I was going to put my glasses on. The problem with my glasses, and this is what happens when you, like I'm ancient, right? But it's 45, and I can't see anything anymore without these glasses. So anyway, next week, please come out for the first of our 3-part AYA speaker series. It's going to be a great night. And you guys will love Barbara from USC. She's fantastic. Our next event coming up, our next 5K is in Arizona, Sunday, March 1st, Tempe. So I know some of you online are signed in from Arizona. Go out and, build your team and get people to donate their $20. March 1st at Kiwanis Park. Dr. Ross from Mayo is chairing that event. Gainesville, Florida. Karen, if you're on board, hi. That's March 7th.
Anybody here live in the Stockton, Modesto area? Tracy?
I'm coming there next.
Oh, sorry.
I haven't gotten there yet.
You were already up.
I'm doing runs. Dallas 5K at Reverchon Park, April 18th. And then this weekend, go ahead.
Melise, our event person extraordinaire over here in the purple shirt, lost a family member to lung cancer. So she's having a fair to remember in Tracy this coming weekend, and we're all going to be there, and many other people from the area, and she's really been rocking it. It's going to be a great night. Yeah. So Athena, I know, you live out there, and you're Greek. We tried to get Nick to come, but he's going to be out of town. But
there will be some other Greeks there, though.
Come if you like.
So those are the next few ones that are coming up that I just wanted to make you guys all aware of. As always, we want to give a huge thank you to all of our sponsors for making this possible. Merck, Lilly, Novartis, Celgene, and Genentech. Of course, Peninsula Television for coming out here every month, and they'll be out here next week too. And for all the support that they give us, we couldn't do it without them. And then the Office Bar and Grill for pasta night here at the living room. So thank you all for coming.
And for any of you that love cookies, Madison and Dylan have been anxiously setting up.
They're setting up, yes.
Their retail store in the lobby.
Please buy cookies. Yeah. And Athena brought cake, as usual. Right. Athena loves to bring, and is so kind to bring dessert. So please grab a piece of cake on your way out to buy a box of cookies. Thanks, everybody.
Thank you.